Welcome to The Explainer. Today, we're going to break down the diagnostic approach to chikungunya virus. This is a topic that's becoming more and more important for every single medical trainee out there.
So here's our game plan. First, we'll dig into the story behind the virus's really evocative name. Then, we'll walk through what a patient actually looks like, how to tell chikungunya apart from its lookalikes, the step-by-step diagnostic pathway, and, this is huge, why getting that diagnosis right and right away is so incredibly important for the long run.
All right, let's start with a clue that's hiding in plain sight. Right there in the name itself, that which bends up.
You know, the name itself is a huge clinical clue. It really paints this vivid picture of the #1 symptom you're going to see in your patients. This posture that's so twisted by joint pain that they literally look like they're bending up. It's a powerful image, and it's one that will definitely stick with you.
And this is where things get really tricky for you as a clinician. This virus is carried by the exact same mosquitoes that transmit dengue and Zika. And that's not just some trivia fact. It means that in huge parts of the world, all three of these diseases are circulating at the same time. That overlap makes your differential diagnosis absolutely critical.
So what does this actually look like when a patient walks into your clinic? Let's build out the acute clinical picture that you're most likely going to see.
Okay, this is not one of those illnesses that kind of creeps up on you. Nope. The onset is famously sudden and intense. A really key piece of history to listen for is how precisely your patient can tell you when it all started. Often they can name the exact day, sometimes even the hour.
And that fever? It's no joke. You're often going to see a high-grade fever, typically over 39 degrees Celsius or 102 Fahrenheit. It usually lasts about 3 to 5 days, but it's that sheer intensity that helps it stand out. Now, when we say polyarthralgia, the poly part is not an exaggeration here at all. It's really common for 10 or more joint groups to be involved, usually in a nice, symmetric pattern. And we're not just talking about some minor aches. This is intense, disabling pain that can literally leave a patient unable to move. Okay, so let's put all the pieces together. What you're looking for is this classic triad: a raging fever, severe pain in a bunch of small joints, and then a rash that pops up a few days into the illness. Oh, and don't forget to check the labs. That dip in lymphocytes and platelets is another really important piece of the puzzle.
But here's the kicker. This classic picture can look a whole lot like other diseases, which creates a serious diagnostic challenge. And that brings us to why chikungunya is often called the great mimicker.
Okay, this table right here, this is your cheat sheet. While there's definitely overlap, the thing that screams chikungunya is the severity of that joint pain. I mean, if your patient is describing their joint pain as the worst they have ever felt in their life, chikungunya needs to be way up high on your list. With dengue, you're more worried about hemorrhage and shock, and with Zika, you're more likely to see conjunctivitis.
So you've got a really strong suspicion. How do you actually prove it? This brings us right to the heart of our discussion, the diagnostic pathway.
Let's think through a real-world scenario. Your patient comes in, it's day 3 of their symptoms. The virus is actively replicating, it's all over their system. What's the best test to order right now to catch it in the act?
Here is the absolute key for testing, and I can't stress this enough, it is all about timing. In that first week, when the patient is viremic, you have to use a test that detects the virus itself. That's going to be your RT-PCR. But after day 8 or so, the virus is much harder to find in the blood, so you pivot your strategy to serology to look for the IgM antibodies the body has started to make.
And this timeline, well, it shows you exactly why that algorithm works so perfectly. You've got this very short window of viremia where RT-PCR is king. Then, right around day 5, IgM antibodies start to show up, and your diagnostic strategy has to shift over to serology. IgG comes later, and it sticks around for years, basically as a marker of a past infection. But why is it so incredibly important to nail this diagnosis? Well, it's because for so many patients, the misery does not end when that fever finally breaks. So let's take a look at what happens beyond the acute phase. Getting an accurate diagnosis is critical because this number is just wow. A staggering percentage of patients don't just get better. They go on to develop chronic joint problems that can last for months or, believe it or not, even years. For most people, this is not a get sick and get better kind of virus. And we are not talking about some minor, lingering aches and pains. The source material uses the word incapacitating for a very good reason. It can completely wreck a patient's quality of life and their ability to just do normal, everyday things.
Now, these chronic problems, they often show up in the very same joints that were hit hard during the acute phase. You'll see this persistent inflammatory arthritis that can look a lot like seronegative rheumatoid arthritis. You'll also see tenosynovitis, especially in the wrists and ankles, and even brand new cases of Raynaud phenomenon. An early, definitive diagnosis helps you set expectations and really guide that long-term management.
So, to wrap this all up, if there's one thing you take away from this, it's this. Remember that clinical picture, the sudden onset of high fever and that awful multi-joint pain. And remember the time-sensitive diagnostic plan. RT-PCR early, serology later. Getting it right can make all the difference in the world for your patient's future.
And that leaves us with a really important final thought. With climate change and global travel, the maps for these diseases are literally being redrawn. What used to be considered a tropical disease is now popping up in more temperate climates. And that makes your clinical vigilance and your diagnostic skills more important now than they have ever been.